Hi, my name is Dr. Awua-Mensah, also known as Dr. Wa on social media. Today, I'm at ALX Ghana, and we're here to give a talk on good oral hygiene. Follow me. With this outline, I'm going to give an introduction. I'm going to talk about the impact of poor oral health, the benefits of good oral health, building a simple oral hygiene routine. That's something that we'll talk about. Making time for oral hygiene and things that we can do to improve our oral hygiene. There will be a session for questions and answers, conclusion, and also talk about my foundation. And if you have anybody who's interested in joining the foundation, we can talk about that. Okay. Great. So as I mentioned earlier, my name is Dr. Awua-Mensah. I'm a dentist. I'm a digital content creator. I'm also pursuing data analytics in order to become a healthcare data analyst. I do a bit of influencing as well. I'm from a family of 5. I'm the last one. I had my primary school education at the Morning Star School at Cantonment, and I went to Prempeh College, Amanfo. Any Amanfo is here? I went to Prempeh College, had my secondary school education, and proceeded to the Kwame Nkrumah University of Science and Technology, where I had my tertiary education, where I had dentistry for 6 years. And afterwards, I did a bit of government work, worked at Konfanoche Teaching Hospital, then went to Greater Accra Regional Hospital and went straight into private practice. So I currently work as an associate dentist at Safari Medical Hub on the Spintex Road, Coca-Cola Runabout. Right, and my hobbies are traveling and playing golf. Okay, so who can tell me what this is used for? Oh, so you friend, see. Really? It's for edges? So A is laying edges, B, scrubbing the corners of bathroom towels, C, polishing shoes. Please do. Oh, wow, that's a tech-based answer. This is to clean the motherboard. But you'll be surprised that some people still use their brush when it looks this way. Yes, we'll talk about all that. And also the type of bristles that you're supposed to use for your teeth. Most people think that it's best to use a hard bristle toothbrush, but the hard bristle toothbrush can damage your teeth and your gums, and it's not advisable. We'll talk about that. Okay. And the other thing we have here is, how often should we replace our toothbrush? Every 3 to 4 months. Are you sure? Yes. It's not weekly, eh? It's not monthly. The other challenge that most tech individuals experience is stress. We all know that the tech world is very, very stressful, very demanding, because you're trying to code, you're trying to analyze data. You don't get time to do anything. You don't even get time to cook. You're always munching on sugary foods. Sugary foods have a detrimental impact on your teeth. And you tend to skip a lot of meals. So skipping the main meals, you favor it for sugary foods, and that is bad for our teeth. That's the reason why I'm here to talk to you about all of this. You may ask, how is the mouth connected to our body? It's a very important question. So, the mouth is the gateway to the human body. Whatever we put in our mouth has an effect on the human body. Aside the effect it has on the human body, if there's any harmful nature of whatever we put into our bodies, it affects our mouth, it affects our lips, affects our teeth, affects our gums. So it's really, really important that we know the connection between our mouth and our overall health. The first thing is that a healthy mouth, it prevents infections. The time I was working in Kumasi, Konfanoche Teaching Hospital, this was back in 2016, getting to 2017. We had a case on the ward. It was an emergency. My team was called to attend to the case. And I remember it was this young individual. He was a cobbler. He had a swollen chest. He looked really puffy. His eyes looked puffy, his mouth, his jaw, his neck was really swollen. And the maxillofacial team was called to come and see him. And it's one of the most common cases we attend to. It's a condition we call Laddo's angina. What that means is that people who have a decreased immune system, the way they react to an infection in the mouth is different from healthy individuals. So in this case, he had a tooth decay, he never treated it, he never went to have it checked at the clinic, he kept applying herbal medications till the infection spread through the jaw, and it went all the way to the throat area. And anything that compromises the area of the neck can have an impact on your airway where we breathe through. So it pushed onto the airway. The guy wasn't able to breathe well. So what we had to do was to make an opening along the chest and the neck area so we could milk out the pus from that area. So this goes to show you that if you have a good oral hygiene, you can prevent this. Because if it gets that worse, people die from this kind of condition. So if you hear that somebody had a toothache and died, it's real, it happens. The other thing is that studies have shown that there's a correlation between gum health and heart diseases. So if you have a severe gum disease and it's not treated, you increase your risk of getting heart diseases, which can later lead to stroke. So it's very, very important. Also, when it comes to diabetes management, people who are managing diabetes, their gum health has a direct impact on them controlling their blood sugar level. That's one area worth looking at. And respiratory health. Sometimes these dental infections, as I mentioned, if it's not controlled well, it can lead to issues with breathing, it can cause pneumonia, that's infections of the lungs, and also pregnancy health. There's also a recent study that has shown that ladies with poor oral hygiene, with severe gum disease, they end up giving birth to children with low birth weight or even having a preterm birth. And I think I read something quite recent, I think 2 or 3 years ago, where they also linked gum disease to infertility in men. But they are still trying to get more research papers on it to confirm that. But those two have been linked together. So as I mentioned, you need a soft bristle toothbrush and a fluoride-containing toothpaste. When it comes to brushing, I realize that a lot of people, they do the up and down motion. Others who do the side and side motion. Yeah, let's move here. Okay. So when it comes to the up and down motion, you end up pushing the gums away from the teeth. And that can expose the roots of your teeth and bring about sensitivity of your teeth. And if you also, so you get something called a gum recession. The gums recede away from the teeth. And if you brush side to side, you end up having these tiny crevices that form at the top of the teeth. That can also result in sensitivity. So it's advised that whenever you're brushing your teeth, you turn the brush a little bit towards the gum. Part of the brush is lying on the gum, some is lying on the teeth. So you brush in a circular motion like this. You don't do side and side, you don't do up and down. You brush in a circular motion like you're drawing circles on your teeth. You do that for all the teeth. You open your mouth. The inner aspects of your teeth, these areas, they are the most neglected areas because we only brush the parts that show outside, but you need to brush the inner aspects of the teeth. So you do a sweeping motion. So it's like you're flicking behind the lower back teeth. Same with the top teeth. So you flick those areas. It's like you're flicking against it. You're sweeping against those areas. Behind the lower and upper front teeth, you hold the brush vertically like this, and then you brush behind those areas. It's really important. You need to brush those areas. Same with the lower one. Hold it vertically this way and brush behind those teeth in this manner. Now, the surfaces used to chew on food, the chewing surfaces, you also need to brush those areas. That one you can brush it normally like you do brush it in the house. You brush the chewing surfaces like this. You brush the chewing surfaces. That one you don't do circular motions. You can brush it normally like this. And last but not the least, the tongue, really important. Like I said, the tongue is like a sponge. It picks up a lot of food substances, and then the germs ferment it and cause bad breath. Take the brush to the back and push it forward. You don't do zigzag like this. No. If you do that and you feel like vomiting, you don't do that in this part of town. You take it to your back and then you push it forward. Take it to the back and you keep pushing forward. And when you're done, you can use your tongue scraper. Also take it to the back, scrape it forward, take it to the back, scrape it forward, take it to the back. So you realize that the tongue looks clean. If it looks a little bit whitish, it's fine. But if it's brownish, meaning there are coatings on the tank. Some people, they want to clean the tank till the tank looks red or pink. You hurt yourself. Just brush it and check to see the coatings are on the tank, then you can stop. Don't kill yourself. Or call emergency. All right, thank you very much. I hope you're with me.